Hello and welcome to this video from Barends Psychology Practice. My name is Niels Barends, and I'll help you understand the results of the borderline personality disorder test you just completed. After submitting the test, your score will appear just above this video. Please check the top of the page to see your results before watching the rest of this explanation. If your score is below 20 points, you most likely do not meet the criteria for borderline personality disorder. Although you may experience some symptoms, they are not sufficient to qualify as a disorder. However, if your symptoms occur in certain situations or after traumatic experiences, I recommend that you complete the PTSD checklist. If your score is between 20 and 48 points, I recommend making an appointment with a therapist. Your answers show that you are experiencing many symptoms that may be affecting your daily life. You may be dealing with borderline personality disorder or another mental health condition. The sooner it's addressed, the better the outcome. You can contact me via the link on the left side of your screen for a free initial consultation. What's next? Here are some self-help tips to help reduce the symptoms you may be experiencing. 1. Learn emotional regulation techniques like deep breathing and grounding. 2. Keep a daily journal to identify emotional patterns and triggers. 3. Practice self-compassion and avoid excessive self-blame. 4. Build a stable daily routine around sleep, meals, and activities. 5. Make time for calming activities, such as music, walking, and drawing. Based on your test results, here are the next steps to consider. 1. Schedule a session with a therapist for further evaluation. 2. Consider taking the PTSD checklist if you have a history of trauma. 3. Repeat this test in 4 to 6 weeks to see if symptoms persist or worsen. If your score is between 49 and 72 points, it is quite likely that you have borderline personality disorder. Please make an appointment with a mental health professional so you can receive a proper diagnosis and begin treatment. What's next? Here are some self-help tips to help reduce the symptoms you may be experiencing. 1. Learn basic DBT skills like the STOP skill and distress tolerance. DBT stands for dialectical behavior therapy. 2. Limit exposure to people or situations that trigger extreme emotional responses. 3. Build a support system. Stay connected with trustworthy people. 4. Use mindfulness or meditation apps daily. 5. Avoid using alcohol or substances to manage emotional distress. Based on your test results, here are the next steps to consider. 1. Contact a mental health professional as soon as possible for diagnosis and treatment. 2. Share your test results with your therapist as a starting point for discussion. 3. If you have a trauma history, complete the PTSD checklist as additional input. If your score is 73 points or higher, your symptoms are most likely significantly impacting your daily life. I strongly recommend that you speak to a therapist as soon as possible. Without treatment, this disorder usually worsens over time. What's next? Here are some self-help tips to help reduce the symptoms you may be experiencing. 1. Focus on daily emotional stabilization. Create a consistent routine and avoid impulsivity. 2. Write a letter to yourself from a compassionate and understanding perspective. 3. Avoid intense conflict and take breaks when feeling overwhelmed. 4. Use grounding techniques during dissociation or emotional outbursts, such as counting down from 5. 5. Keep a list of helpful crisis activities. Think of taking a warm shower, going on a walk, or talking to a close friend. Based on your test results, here are the next steps to consider. 1. Schedule an appointment with a therapist immediately to start evaluation and treatment. 2. Consider long-term therapy focused on BPD, such as DBT or schema therapy. 3. If trauma is part of your history, fill out the PTSD checklist and bring it to your first session. 4. Don't postpone getting help. Symptoms usually worsen without intervention. Remember, this test is just a screening tool and not a substitute for a professional diagnosis. If you're unsure about your results, don't hesitate to contact a therapist. If you'd like support or have questions about your results, feel free to reach out. Help is available, and you don't have to go through this alone. If you found this video helpful, please give it a like and subscribe to the channel so we can continue creating content that supports your mental health. Thank you for watching.